There is a white powder sitting in warehouses right now. It costs less than $3. And if you are over the age of 50, what I am about to tell you may be the most important thing you hear this year. Not because it is complicated, not because it requires a prescription, not because you need a specialist or an expensive protocol, because it does not require any of those things, and that is exactly why almost no one is talking about it. This powder rebuilds what inflammation has been destroying in your joints, your muscles, and your arteries for the last decade. It restores cellular energy in people who have tried everything and still wake up exhausted. It has been documented in medical literature since the 1800s, used by military field surgeons, referenced in natural medicine guides across 3 continents, and then quietly moved to the back of the shelf when something more profitable came along. Stay with me for the next few minutes, because by the time this video ends, you are going to understand something about your own body that the supplement industry has spent 60 years hoping you would never figure out. Let me ask you something honest. How long have you been dealing with it? The stiffness in the morning that takes 45 minutes to work itself out. The low energy that coffee used to fix but does not anymore. The ache in your knees, your hips, your lower back that your doctor shrugs at and calls normal for your age. The inflammation that you can feel but cannot seem to touch. Here is what almost nobody tells you about what happens to the human body after 50. It is not just aging. Aging is a word we use to describe a dozen separate biological processes that all begin accelerating around the same decade of life. And the single thread running through almost all of them? The joint breakdown, the muscle loss, the cognitive fog, the circulation problems, the slow wound healing, the unexplained fatigue, is a mineral deficiency so common, so widespread, and so thoroughly misunderstood that millions of people are living with it right now and have never once been told what to look for. The mineral is magnesium, but not the magnesium you have heard about, not the form sold in most pharmacies, not the cheap oxide powder in the bargain supplements that your body absorbs less than 4% of. I am talking about a specific form of magnesium with a specific delivery mechanism that researchers were studying intensively in the 1940s, 1950s, and into the 1960s. And then, clinical interest shifted. Not because the science changed, because the economics did. And what happened next is a story that should make every person over 50 genuinely angry. To understand why this matters, you need to go back about 200 years. In the early 1800s, physicians in rural England noticed something unusual. Farmers and laborers who worked land with naturally high magnesium content in the soil, the areas around Epsom, Derbyshire, parts of Wales, had markedly lower rates of muscle cramping, joint swelling, and what they called the rheumatics. The connective tissue problems that plagued most working people over 50 were less common in those communities. By the 1840s, physicians were deliberately prescribing magnesium sulfate baths to patients with severe joint inflammation. The results were documented, reproducible, and considered standard medical care. Jump forward to 1915. A French military physician named Dr. Pierre Delbé is treating soldiers with severe wounds on the Western Front. He notices something that becomes one of the most important and least cited observations in the history of battlefield medicine. Soldiers with higher magnesium levels in their blood, identified through serum testing, survive traumatic injury at significantly higher rates. Their tissues heal faster. Their infections resolve more readily. Their nerve function recovers more completely. Delbate spends the next 20 years studying magnesium and cellular immunity. His work is published, it is cited, and then it is largely forgotten. By 1940, the United States Army is issuing dietary guidance that explicitly includes magnesium as essential to muscle performance and nerve recovery under physical stress. Field medical manuals from 1942 and 1943 document the relationship between magnesium depletion and what soldiers called the shakes. the muscle tremors, fatigue, and cognitive slowdown that emerged after prolonged physical exertion. The science was not a secret. What happened next was not a scientific development. It was a commercial one. After World War II, the pharmaceutical and supplement industry entered an extraordinary period of expansion. Companies that had spent the war years manufacturing compounds for military use needed consumer markets. And consumer markets required a specific kind of product, one that worked well enough to create loyalty, but not so completely that it eliminated the need for continued purchasing. Here is the economic logic that drives everything you will hear next. A mineral supplement that fully corrects a deficiency and maintains correction with low-cost, accessible dosing is a product you buy once and rarely need to restock. A branded supplement with proprietary formulations, monthly subscription packaging, and intentionally low bioavailability is a product you buy forever. Magnesium oxide, the cheapest, least absorbed form of magnesium, became and remains the dominant form in mainstream supplements. Not because it is most effective, because it is cheapest to manufacture, easiest to patent in combination formulas, and produces just enough perceived benefit to generate repeat purchasing without ever fully solving the underlying deficiency. Meanwhile, the forms of magnesium that genuinely penetrate tissue, that cross the blood-brain barrier, that absorb into joint cartilage, that restore cellular energy production at the mitochondrial level, were repositioned as premium specialty items at 10 to 20 times the cost of the raw compound. The raw compound itself, available in bulk from agricultural and food-grade suppliers, costs less than $3 per month at therapeutic dosing. But here is the detail that changes the entire picture. The industry did not just make the cheap form dominant, it actively suppressed research funding into the high bioavailability forms. Between 1965 and 1995, published clinical trials on magnesium and musculoskeletal function dropped by more than 70% compared to the prior 2 decades, even as the older research remained on record showing consistent efficacy. The data did not disappear, it simply stopped being funded. Let me show you why this matters inside your body, because the chemistry is genuinely remarkable. Magnesium is involved in over 300 enzymatic reactions in the human body. That number is not a marketing claim, it is documented biochemistry. But 300 reactions is an abstract number that does not tell you what you actually feel when you are deficient. Here is what you actually feel. Your muscles cannot fully relax between contractions. Calcium drives muscular contraction. Magnesium drives muscular relaxation. Without adequate magnesium at the cellular level, your muscles remain in a state of chronic partial contraction. That is why the cramping happens. That is why the stiffness does not resolve. That is why the lower back that should loosen after 20 minutes of movement stays tight all day. Your joints begin breaking down faster than they can repair. Magnesium is required for the synthesis of proteoglycans, the compounds that form the gel-like cushioning matrix inside cartilage. Without adequate magnesium, cartilage cannot regenerate at the rate it degrades. The joint does not just hurt, it is structurally deteriorating. Your arteries begin to calcify. This is the one that most people over 60 are not being told clearly enough. Calcium deposits in arterial walls. Arterial calcification is one of the primary drivers of cardiovascular risk after 50. Magnesium regulates calcium's behavior in blood vessels, preventing it from precipitating into the arterial wall. Low magnesium and high calcium intake without adequate magnesium balance is one of the most common dietary configurations in Western adults over 50. The result is measurable in imaging studies. Your brain begins to work harder for less result. Magnesium threonate, a specific form that crosses the blood-brain barrier, restores synaptic density in the hippocampus. The hippocampus is the region responsible for new memory formation. Research published in peer-reviewed neuroscience journals shows measurable improvement in working memory and processing speed in adults over 60 who restore magnesium to optimal levels in brain tissue. And your mitochondria, the energy-producing structures inside every cell in your body, cannot function at full capacity without magnesium. The molecule that transfers cellular energy, called ATP, is biologically inactive unless it is bound to magnesium. Every unit of energy your body produces requires magnesium to become usable. When tissue magnesium is depleted, your cells are producing energy they literally cannot use. That is what chronic fatigue after 50 actually is in millions of people. Not age, not laziness, not a character flaw. A mineral sitting in a $3 bag that nobody reminded you to take. Here is how you know the science never actually disappeared. It retreated into the communities that could not afford to stop using it. Elite athletic training programs have never stopped prioritizing magnesium. Recovery protocols for professional sports teams include transdermal magnesium application, direct absorption through the skin, as standard post-competition therapy. The trainers know what the supplement aisle never told you. Oral magnesium oxide does almost nothing. Form and delivery pathway matter completely. Integrative physicians working with autoimmune patients routinely use IV magnesium infusions for acute inflammation management. The results are documented. The mechanism is understood. The treatment is not new. It was standard in clinical protocols in the 1950s. Cardiologists in Europe, particularly in Germany and Austria, have maintained a strong clinical tradition of magnesium supplementation for arrhythmia and hypertension that simply never developed the same stigma it acquired in American mainstream medicine. A nephrologist at a major teaching hospital in the American Southeast, who asked not to be identified by name, described it plainly in an interview in 2021. He said that when he reviews the incoming lab panels of patients over 60 who present with fatigue, muscle weakness, hypertension, and early cognitive changes, the single most consistent finding is not a dramatic pathology. It is low red blood cell magnesium. Serum magnesium looks normal because the body pulls magnesium out of tissue to maintain blood levels. The tissue deficiency is invisible to standard testing, and nobody orders the right test. The knowledge is not hidden. It is simply stored in places that do not run television commercials. Now here is the part that requires your full attention, because this is where most people go wrong even after they decide to act on this information. Not all magnesium is the same. Magnesium oxide, less than 4% absorbed, produces laxative effect at higher doses, almost no tissue penetration. This is what most supplements contain. Magnesium citrate, 30 to 40% absorbed, better than oxide, useful for general supplementation, does not cross the blood-brain barrier effectively. Magnesium glycinate, 50 to 80% absorbed depending on individual gut health, gentle on digestion, good for sleep and muscle recovery. The form most recommended for people over 50 with digestive sensitivity. Magnesium threonate, the only form with documented blood-brain barrier penetration, specifically indicated for cognitive support, memory, and neurological recovery. More expensive, but the only form that actually reaches brain tissue. Magnesium malate, high bioavailability, specifically beneficial for muscle energy production and chronic fatigue. Particularly relevant for people dealing with fibromyalgia-type pain patterns. The raw compound that costs $3 from a bulk supplier is magnesium chloride. Food grade, high bioavailability, and the form most commonly used in transdermal applications. You dissolve it in water and apply it to skin, directly over a sore joint or along a cramping muscle, and absorption begins within minutes. This is the delivery method that military field medics used. Apply over the tissue that needs it. Bypass the digestive system entirely. Get the magnesium directly to the cells that are deficient. A 250-gram bag of food-grade magnesium chloride flakes costs between $3 and $5 and provides roughly 60 to 90 individual applications. That is less than 6 cents per treatment. Here is exactly what to do, because information without a clear action step is just frustration. For joint pain and morning stiffness, Purchase food-grade magnesium chloride flakes from any bulk mineral supplier, agricultural supply, or online food-grade chemical retailer. Mix 60 grams into 500 milliliters of warm water in a spray bottle. This creates what is commonly called magnesium oil. It is not actually oil, but it has a slightly oily texture on the skin. Apply directly to painful joints, knees, hips, shoulders, lower back, immediately after a shower when pores are open. Leave on for 20 to 30 minutes, then rinse or leave as preferred. Apply once daily for the first 4 weeks. Most people report a reduction in morning stiffness within 7 to 14 days. Not because the compound is pharmaceutical, because the deficiency was the cause, and addressing the deficiency resolves the symptom. For chronic fatigue and low energy, add magnesium glycinate capsules, not oxide, at a dose of 300 to 400 milligrams in the evening. Evening dosing is more effective because magnesium supports the parasympathetic nervous system shift into recovery mode during sleep. Do not take magnesium oxide regardless of what the label says about equivalency. The absorption difference is not marginal. It is the difference between taking it and not taking it. For cognitive fog and memory support, magnesium threonate is the specific form. 1 gram to 2 grams daily, taken with a meal. Research from the Massachusetts Institute of Technology, published and peer-reviewed, showed measurable improvement in working memory in adults over 60 after 12 weeks of magnesium threonate supplementation. This is not anecdote. It is controlled clinical trial data. For blood pressure and arterial health, the transdermal magnesium chloride protocol described above is particularly relevant here. Consistent transdermal magnesium has been shown in European clinical studies to measurably reduce arterial stiffness, a key marker of cardiovascular risk, over 12 to 16 weeks of daily application. Always consult with your physician before beginning any new supplementation protocol, particularly if you are on medications for kidney disease, heart rhythm, or blood pressure, as magnesium interacts with several drug classes. But consult your physician armed with this information. Ask specifically for a red blood cell magnesium test, not a serum magnesium test. The serum test misses tissue deficiency in the majority of cases. The RBC magnesium test shows actual tissue levels. Insist on it. In 2022, a team of researchers published a systematic review in the European Journal of Nutrition analyzing 93 separate studies on magnesium status and chronic disease in adults over 50. Their finding was not subtle. 68% of adults over 50 in Western countries are deficient in magnesium at the tissue level. Not borderline low, clinically deficient. And of that group, fewer than 12% have ever been told about it by a physician or had the appropriate diagnostic test ordered. 68%. Think about what that means in practical terms. If you are sitting in a room with 9 other people over 50, statistically, 6 or 7 of them are walking around with a chronic mineral deficiency that is directly accelerating joint breakdown, muscular weakness, cognitive decline, arterial calcification, and metabolic dysfunction, and almost none of them know it. They have been told it is age. They have been sold supplements that do not reach the tissue that needs them. They have been prescribed medications for symptoms that are, in a significant number of cases, downstream consequences of a problem that a $3 mineral solution would meaningfully address. The pharmaceutical industry generated $480 billion in global revenue in 2023. A correctly dosed, high bioavailability magnesium supplement that maintains tissue sufficiency costs less than $15 a month. You do not need to wonder why one of those numbers is discussed extensively in your physician's continuing education and the other is not. Dr. Pierre Delbé died in 1957. Having spent the last 40 years of his career documenting what magnesium did for the human body under stress, physical, inflammatory, and neurological. He did not know that the pharmaceutical economy was about to spend the next 60 years building an infrastructure designed to make sure that a $3 mineral would never compete with a $60 monthly subscription bottle. He only knew what the data showed. And the data was consistent. The mineral worked. Here is what I want you to carry out of this video. Your body is not failing because of age. Your body is operating exactly as a magnesium-deficient body is documented to operate. Stiff joints, chronic fatigue, cognitive friction, elevated blood pressure, slow recovery. These are not mysteries. They are consequences. And consequences, unlike age, can be addressed. The powder is real. The science is documented and accessible. The cost is lower than a single bottle of branded supplements that will not solve the problem. And the professionals who never stopped using it, the integrative cardiologists, the athletic trainers, the military medical researchers, have been waiting for you to remember it exists. Now you remember. Ask your doctor for the RBC magnesium test this week, not next month, this week. And if you found this information useful, share it with someone over 50 who deserves to know it. Because some knowledge should not stay buried, and this one has been buried long enough.